Well, Shyatto, thanks very much for joining us. Congratulations on your work you're doing. From what I've been reading, there are three countries at the forefront of technology and medicine: Israel, America, mainly Silicon Valley, and India. In fact, I met some kids from Silicon Valley, and they worked on AI, which with a smartphone, they can detect 29 kinds of, they can diagnose 29 kinds of illnesses that a person can have remotely, just with a smartphone, 29, and they're going to get it up to 100 and God knows how much. Tell us what you're doing and how it's taking this huge gap between services and the patient forward.
So first, boss, nice to see you again. And this is a kid in a candy store moment for me to be on screen with you. So it's taken probably 30 years to get there, but really nice to be on screen with probably the best boss that I've ever had. So nice to see you.
Well, it's an honor for me also. Proud of you.
Thank you. But I think to the point that you made, I think India today, I'll give you another example. We were in London about a few months ago, meeting with the NHS. We thought, we were going to study the NHS system because we've heard so much about it. But the more we spoke to them, like you correctly said, we realized that India is actually 10 years ahead of the NHS system, be it in terms of technology, be in terms of the quality of care, be in terms of the way that we are able to wrap ourselves around the patient using technology and delivering healthcare. So I think that I have to commend both the healthcare providers plus the great Indian startup ecosystem, which has worked very hard towards this. Where we are focused on is two parts of it. One, I think like Neeraj was talking about, telehealth, etc., is one part of it. But ultimately, we have a huge shortage of doctors and nurses in this country. I mean, just broad numbers. Again, there's not accurate statistics, but we are short of about 1.5 million doctors and about 2 million nurses just to get to the WHO standards, right? So the only way you're going to be able to get better access for these doctors is to try and bring more efficiency into the system. So what we've done is we've actually used digital technology to try and bring all the patients' clinical information and present it to the doctor in a meaningful way so that he can take better decisions, more accurate decisions very quickly. Therefore, he's able to see more patients and give better access to healthcare to larger, we've actually been able to now give care to patients in Kanpur, in Lucknow, and well beyond that, sitting out of Delhi.
Right. Fantastic.
Just one thing I want to add, Dr. to the point that Mr. Bachchan was making about the blood samples. I think another bit that the Indian startup ecosystem has been able to fulfill is that there are companies which have been able to bring out point-of-care devices. So where actually blood sample drawn, the results can actually get populated through a mobile platform at the location itself. So I think it's very early days, but they've done some real amazing breakthrough. And this is in states like Orissa and in states like Bihar, where they're piloting these programs.
Wow, that's very interesting.